Prior to a couple of years ago, the Royal College, which licensed all specialties in Canada, only recognized general psychiatry. In addition to child and adult psychiatry, they also recognized forensic psychiatry and geriatric psychiatry. So they were all recognized at the same time, and there was a big push across the country to try to, write the documents for the specialty so schools could get up and running. Residents just really are interested in the program and see the educational opportunities and want in. We provide a really good training program, and having that extra subspecialty training is really something they want. Down the road in a few years, the standard at academic teaching hospitals will be that one has to have the subspecialty designation from the Royal College. We have a very comprehensive process of applications. We ask the residents to, in addition to sending their CV and references from people that they've worked with, we also ask them to write a letter of intent. And I always tell them to be very, very thoughtful about this letter, because you have to figure out a way to stand out from your peers. And I think that carries over into the interview process when we really talk to these residents. We really want residents, I mean, they're all good residents. We're looking for ones that are really committed to child and adult psychiatry, that really have obviously strong clinical teaching skills, research skills, but really committed to the program as well, making the program better as well as their own training. It's a very difficult task to pick the residents, but it's a very rewarding one because we get to pick the best of the best. Part of the requirements of the training are that each resident does a scholarly or research project during the 2 years. So the way we've set that up is each resident identifies or is identified for them a mentor that they have, a research mentor that they start with. And in the division, there are many of our staff in the division are primarily researchers or clinician researchers. So we have lots of opportunity in a variety of different areas of child and youth mental health for research. Also in the second year of your residency, part of the training requirements are that if you would like, you can do a full 6 months of research only. And a number of residents are starting to think about doing that in their second year. I generally have a senior resident with me for 6-month rotations, and what I have them do is I say, okay, go and pick an agency where they need some mental health care. And go and start to consult to that agency. Start this process for yourself and learn what it's like to work with this population and work in a team to try to help the organization and the children and youth that they work with. So I find that really rewarding, working with the population, but also introducing residents to this type of work.